We share a story that touched hearts around the world, the passing of Pope Francis at the age of 88 on April 21st, 2025. However, this video is more than just a tribute. It's an opportunity to reflect on the quiet risks that many elderly people face every day. It's about how we can better protect our health and the health of our loved ones through awareness and preventive care. Pope Francis had been dealing with health challenges for several years, but it was in February 2025 when he was hospitalized with a severe case of bilateral pneumonia. While he showed some signs of recovery, his overall condition remained fragile. According to the Vatican, the official cause of death was a stroke, combined with irreversible heart failure. Respiratory infections like pneumonia can be particularly dangerous for the elderly. They weaken the body, placing a heavy strain on the immune system and often affect the heart and brain as well. That's exactly what happened to Pope Francis. Even after being discharged, his body couldn't recover fully. Sadly, what happened to the Pope is a common reality for many people over 60. And on this channel, we always highlight the fact that stroke and heart failure are two of the leading causes of death among the elderly. But the good news is, there's a lot we can do to reduce these risks. Let's get started. Pneumonia, the silent threat to our lungs. Pneumonia is an inflammation of the lungs, typically caused by viruses or bacteria. It's as if the lungs, which should be filled with air, become filled with fluid and secretions. In older adults, this condition is far more dangerous. As we age, our immune system weakens, and it takes longer for the body to fight back. Sometimes, by the time it does, it's too late. Many elderly individuals already live with chronic conditions such as bronchitis, asthma, emphysema, or acid reflux, all of which make it easier for infections to reach the lungs. Additionally, coughing, which is our body's natural defense mechanism, becomes weaker with age, making it harder to clear out secretions. Early symptoms can be subtle, a mild cough, fatigue, or shortness of breath while climbing stairs, but these symptoms can quickly escalate into fever, chills, confusion, and difficulty breathing. That's why it's crucial to pay attention to any sudden changes in behavior or energy levels. A cold that doesn't go away could be the beginning of pneumonia. The best prevention is getting vaccinated, maintaining a balanced diet, and having regular checkups with your doctor. 2. Bilateral pneumonia. When both lungs are affected, bilateral pneumonia is a more aggressive and dangerous form of the illness because it affects both lungs simultaneously. This dramatically reduces the body's ability to absorb oxygen, and without oxygen, every organ begins to suffer. It's as if an elderly person is trying to breathe with waterlogged lungs. The effort is overwhelming, and the body quickly wears out. Bilateral pneumonia requires extra attention because it can worsen very quickly, sometimes within just a few hours. It may lead to respiratory failure, organ shutdown, and even cardiac arrest. For Pope Francis, this was the first major battle in his final months. His case of bilateral pneumonia was so severe that even after being discharged, his body couldn't fully recover, and this opened the door to further complications. Heart failure. When the heart loses its strength, the heart is a pump that never stops, working day and night to send blood, oxygen, and nutrients throughout the body. But just like any other part of the body, the heart ages too. Heart failure occurs when the heart can no longer pump with the necessary force. It still beats, but not strongly enough, leading to a chain reaction throughout the body. Blood begins to accumulate, especially in the legs, causing swelling. Breathing becomes difficult when walking, lying down, or even at rest. Simple tasks like sweeping the floor or taking a shower can become exhausting. Many elderly people mistakenly think this is just part of getting older, but it's not normal to feel constantly tired, have chest pain, or need to sleep sitting up just to breathe better. These are clear warning signs that the heart is under serious stress. For Pope Francis, the strain on his heart came from years of gradual wear and tear, further exacerbated by pneumonia and his overall physical decline. Eventually, his heart couldn't handle the strain, leading to heart failure. 4. Stroke. The silent and dangerous brain attack stroke, or cerebrovascular accident, CVA, is one of the most significant health risks for the elderly. It happens when blood flow to the brain is interrupted, either due to a blockage, an ischemic stroke, the most common type, or by the rupture of a blood vessel, a hemorrhagic stroke which is more severe. When the brain is deprived of blood, it begins to shut down. Depending on which area of the brain is affected, the consequences can be devastating. Loss of speech, paralysis on one side of the body, confusion, memory loss, imbalance, and even coma. The most dangerous part. The symptoms often appear subtly, slightly slurred speech, tingling in one arm or stumbling for no apparent reason. And it's common to hear it'll pass or it's just tiredness, but it's not. Hair stroke is an emergency, and immediate medical help can make all the difference in reducing damage. For Pope Francis, a severe stroke, combined with his already weakened heart and lungs, ultimately became the final blow. Immune system weakness. When the body can no longer fight back as we age, our immune system weakens. Our body's defense cells become slower, and it takes longer to react to viruses, bacteria, or inflammation. This means something as simple as a cold can evolve into a serious flu. A urinary tract infection can cause confusion, or even a small cut can lead to a full-blown infection if not treated properly. On top of that, many elderly people live with chronic conditions like diabetes, kidney issues, osteoporosis, or anemia, and take multiple medications daily, which further weakens their immune system. Emotional health plays a role too. Loneliness, sadness, and anxiety directly impact immunity. A sad heart makes the body more susceptible to illness. That's why taking care of your immune system goes beyond just vitamins. It's about proper nutrition, adequate sleep, regular exercise, emotional well-being, and social connections. This type of regular care can prevent something as simple as a cold from developing into pneumonia or help uncover a hidden heart problem. Pope Francis was a beacon of faith, humility, and compassion. His passing saddens us, but it also inspires us to care more deeply for those around us. If you're over 60, or you care for someone in that age group, take a moment to reflect on your habits and invest in the health of the heart and mind. After all, every healthy day is a blessing. And of course, if you haven't liked the video yet, now's the time. Subscribe to the channel, turn on the bell for notifications, and stay up to date with important tips on health, well-being, and quality of life. Here, every video is made with great care, thinking of you and the people you love. And as always, we finish with our motto, health and vigor to cure any pain.